so that you can have it. I think the biggest problem in acupuncture is to believe in it, that it works. And you can only believe in it if you have done it, and if you had some successful cases. My very first experience when I heard about acupuncture, that I had a try, but it was not so good success in it, and so I heard that in Vienna, it's only 4 hours by train from Munich, where I am living, that I had anesthesia for operations in the ENT clinic. And so I went by train to Vienna. And I came on a Wednesday. And at this day they had some operations, especially tonsillectomies. And I met the professor. This was a university clinic. And the professor was very open. He allowed that acupuncture was done in his clinic. And patients were sitting there with needles. So, hello? Fine. Patient had 2 needles. The one needle sticking here, acupuncturists know this point, and the other needle sticking here in the thumb. And when I came this day, there was a problem. They had one anesthetist was sick, and so the operator said to me, please sit here on this chair beside the patient, and I had to turn the needles for about 20 minutes, half an hour. Or is this, you know, this little, what do you call this? Swirl. Sorry. And I did it, and after I had done so many tonsillectomies, many hundred maybe, and I think the patient was perfect. There was no gap. There was nearly nothing, no bleeding. And after operations, the patient stood up and went upstairs in his bed. Normally, narcotized, and sleeping and everything. So I said, there's something in it. The next patient, same experience. 3rd patient, 4th patient. And when I went home by train again, that now I have to realize some new within myself. What really worked. And I said, this is the most important experience we all need. To see something that can convince us. Maybe there can come more. We begin here.
Well, I think this might be it. And if they come late, they'll come late.
Okay. Was this Dr. Bishko's clinic you joined?
This is Dr. Bishko's clinic.
Yeah.
This was Dr. Bishko's clinic.
Okay, well, before we begin, I'm glad you're all here and getting here on such short notice to hear Dr. Gleditsch speak. And there's a number of people that kind of helped this to come about, and I think we should just thank them. For one was Dr. Diamond, who has very graciously let us use his facility, and even more so, he was really the contact between Dr. Gleditsch and here in the United States. He had met Dr. Gleditsch 3 years ago at an acupuncture conference and has been using his techniques for a number of years. And very often I would see Dr. Diamond and he would say, you gotta go to Germany, you gotta go to Munich, this is wonderful. This is what every dentist should know. This is because what it does in a very real sense, in a technique sense, and also in a philosophical sense, it lets us see that we are not just treating teeth, that the way Western medicine has evolved, that everything is segmented. The head and neck, dentistry, internalists, specialists, and even acupuncturists. Now in New York State, you need 300 hours, and because of the specialization, we lose track, we lose the perspective that we are total beings, and what we do in the mouth as dentists is affecting the entire system, and us being in the mouth, we can detect things that are going on, and we can affect them in a therapeutic way as dentists. And that is what is so powerful about the work that Dr. Gleditsch has been doing over the last, 15 years that you've been doing the acupuncture. So it has been through the inspiration of Dr. Diamond that Dr. Gleditsch is here in a very real sense. In addition, Dr. Hinden has been very helpful in counseling me in how to organize these seminars, which are I'll tell you, a lot more than I could have imagined is involved. And also for making many phone calls and contacting people.
And giving travel directions.
And giving traveling directions, yes. I think I know how to get here better than I know how to get home. Okay. I think that you're all going to find this very valuable and useful, because you can, tomorrow, back in the practice, start palpating and feeling things and getting another sense of what might be going on in our patients. And so no longer to be looking at the amalgam that needs to be restored because of their toxic effects, but that there is a system, which is one of our first influences now, of systemic medicine and dentistry, which has now become very, very provocative, that we are realizing that there are profound effects by the dentistry we do and the dentistry that we don't do. So from here, Dr. Gleditsch.
Right. I have to thank you all that you came here. I'm very thankful that we can do it here in this house. I came here to Dr. Daniel's house my first time. We have met several times, once in New York, once in Munich, another time in Switzerland, very short time only. But to stay here and to have the seminar here in his house, is a very good atmosphere indeed. And he will help us a lot, for I have been inspired by his ideas a lot. And so it's very good to meet each other and not to think that there are distances between Europe and the States or whatever it is, that we really can meet now. And I'm so thankful for you who organized it here so well, Alan and his wife, and you all who helped him to help that it can be done here. And my problem is my bad English. I have to say that I have problems. Normally I do it together with Emily, my wife. She's a perfect interpreter. She has interpreted John Diamond in Munich and was perfect. But I, when I'm alone without my wife, help us sometimes. Please help me, or we will try to get these words or this what we need to understand. So I think thanks to you, John Diamond, thanks to you, Alan, and so we begin with this. We had to talk about, we talked about 2-3 minutes acupuncture. With John Diamond we talked yesterday the same, that the word is no good word. What we mean when we talk about acupuncture is quite another, holistic medicine. And acupuncture for us is quite an approach to get it, and to come in quite another thinking of correlations within the body, of understanding the underlying patterns. And acupuncture may be of the many systems we now can find and realize, for example, the homeopathy, symbiosis, physiotherapy, to treat by plants. We call it phytotherapy. But all the holistic kinds of medicine, they are so wonderful and interesting for us now. But acupuncture is the most systematic. And as we are trained to learn and to understand in a systematic way, so acupuncture may be a very systematic access for us to come in this field. The word itself means sharp. Acu is sharp, and puncture is to cut or to put in needles, and we do it. But maybe it takes only some more year, and we will finish and maybe treat by colors. We have a colleague in Germany who has developed now a method to treat by music, special frequencies of music onto special points, and it works perfect. And so we have a soft laser, you have heard about it, that can treat the points. So sticking a needle is one of the possibilities. And that what is so good for you as a dentist. Sticking in a needle, applying needles in the oral cavity, it's better done than on the skin. For the mucous membrane, they are so soft. The tissue is so weak that really, with a very fine cannula, can do it without any problem for the patient. You don't hurt him so much, and the patient would take it. Another thing, we have learned in Germany that acupuncture just nowadays has become very modern. And it's very bad for a doctor to do a method that is modern. For you attract patients that will be in the modern treatment. And they come from long distances and they have heard about the modern acupuncturists. And so you get patients, maybe that they are very nice patients, but many of them, these are patients who are running here and running there, running for a new thing and another new thing. First they are so content, and after 2-3 treatments they run to the next one and talk bad about you. In our field, in the oral cavity, it is so wonderful, and I have done it in more than 10 years, that I treated patients at special points in the mucous membrane, and I never told the patient what I do. I only did it. I didn't say to the patients that I'm an acupuncturist, that I learned it. And I didn't say that they had to pay something extra for it. I only did it. In my normal work as an ENT doctor. And if I succeeded to help the patient with his lumbar spine problems, or with his sciatica, or with his shoulder, or what it was, so he came to, what did you do? Oh, I said, fine, good, okay, maybe that was a point in the mucous membrane. But I didn't say the word acupuncture. So I really could say, in the 10 years experience, there was no suggestive influence. And this was very important for me to realize. For I'm a very skeptic man, full of criticism. And many of you will be too. And to overcome this criticism, to overcome their own skepsis, is only by success in the special method. When John Diamond came to Munich, I remember a wonderful experience. You asked 2 of our doctor group, they had the same group as here, about 80-20 doctors, and with this wonderful test, the muscle test, if they will be cured. And one had a problem, I remember, in the cervical spine, another one in the lumbar spine, and both had the answer, no. And I couldn't understand why it is. Why the patient, the doctor in this case, couldn't accept to be cured. But at that time, I realized what it is with this special method. This is testing. That in our unconsciousness, in our inner part, which sometimes is so much deep within us, that we are not in contact with it by our brain. But it's not like another man within us. That sometimes we are 2 persons. One that is standing here and another says as the contrary. So when we have this test, for example, the contrary man gives the answer, is it? And so I've seen many of our problems we will cure with our patients. It doesn't work because inside there's something full of criticism in our patient, full of skepsis, and it wouldn't accept what we do, it wouldn't agree. Patients with a frozen shoulder, they had been with many doctors, orthopedists, they had been in a hospital, wherever it was, and they hadn't been cured. So more and more hopelessness begins to settle down inside. And in acupuncture, what you can do in the oral cavity, we have points where really the success can come up very quickly, spontaneously. So the patient says, I feel it, it's possible to move again. And that is the best way to convince our inner, contrary man that it's possible to cure it. We have learned another experience, that sometimes you will be able to help a patient to overcome, for example, such joint problems. But it only helps for 1, 2, 3 days or for a week, and then it's bad again. And another attempt may help only for 1 day, bad again. And you can't help the patient. But you have done a good work, because you have convinced the patient that it can be better. Whatever he now does, if he goes to another doctor, or if he got other remedies, but he has seen that this joint can be moved again. If it only was for some hours or for one day, but his subconscious, in a contrary man, has realized that it is possible again. And this you will succeed in many cases in the next years, you will see. The problem in dentistry, and we have to talk a lot about it, you have much more experience in it than I have, is that we have so many, as we call it in language, in our language, focus. You know the word focus? Focuses maybe root-filled tooth, maybe the tonsils, maybe the sinuses, and that makes it so difficult just nowadays to help patients overcome their problems. That we sometimes get success for one day, for 1 week, for 1 month, but after this time, all the old pattern builds up again because the focus is still in the mouth, is still in the sinus, is still in the tonsils, and we know that most of our problems that we call focus, whatever focus is, we will talk about later on, that these focuses are situated in the field that is ours. It's dentistry and ENT. And so we are responsible for all these problems. And one of you this morning said to me a wonderful word that we really have to rethink all we have done in dentistry. And I said, it's the same with ENT. We have to rethink all that is done up to now in our ENT field. For we realize more and more that what we have done in so many years, it worked in a way, but as we begin thinking holistic, seeing the whole man with all his problems, the more we realize that we have to change. We have to think in a new way. We have to change our methods, not to change that all the old methods have to pushed out, but to take in some new methods, some alternative methods, some additional methods. And by taking in more and more additional methods, we can judge what is better, we can choose, I will have this one or the other one, and that works. The problem, again, is if you begin to change, if you begin to work with an additional or another method, you will have problems in the beginning. For me, it was when I first time realized that I can't cure a sinusitis, a chronic sinusitis, by another remedy, another antibiotic, another chemotherapeutic remedy. It was, for me, as if the ground was taken off it, as if I would hang in the air without ground. For as long as I give an antibiotic, I am so sure I did a good work. And if the patient would go to the hospital the next day and say, oh, it's so worse, please help me. And the professor in the university would say, who was the doctor? Gleditsch. Okay, what did he do? Antibiotic. Perfect. But if he now comes to the hospital on Sunday, then I am not at home, and he says, Dr. Gleditsch, he did yesterday acupuncture, but he didn't give me any remedy, no antibiotic, nothing. Oh, what was the professor say to him? He said, a very bad doctor. He will judge me. And we have such cases in Germany. Maybe it's the same as the States. It's a big problem. Is it?
You gotta be kidding.
That is really our problem. We have to be so sure in our methods. We have to begin careful. And we have to begin alternatively that we can do the one as the other. And if we are very sure, now I have, after 15 years, I have learned so much, for example, about sinusitis, that I never use antibiotics in sinusitis treatment. Later on I will explain you why. For me it is like to do some bad to the patient. But I can't now stand on it, because I have a 10 or 15 years experience in it. But the first years, they were terrible. Sometimes at evening when I went to bed, I said, oh, what did you do today? So begin careful. Sometimes we are so enthusiastic if we have learned the new methods that we say, now we do everything with this. Be careful. Take it here, in this case, take it in the other case. Gather your own experience, here a little, there a little, and the other is stay never lonely in this experience. The best is that we are groups. groups that meet here together in your house, groups that have contact. You can call you by telephone and ask, oh, I had a bad experience. Please, what is your experience about it? The worst is to be lonely. For if we go a new way, we have to go together and to help each other. So it's no problem for us. But this is really a new age that has begun. I was invited in the year 92 and 82 and 80, 83 and 84 to European dental congresses, meetings at Switzerland, Davos. And this society is, most of the teachings are normal medical work. The professors of the university are teaching there, but we are invited, 2, 3, 4 men with another view of dentistry. Dr. Trame, one of you met him, yes, he came there 2 years ago, and Dr. Voll, you have heard his name, he was invited several times, and they invited me 2 times now. It was wonderful. At the end of the workshop, there is a paper, and you can write in, if you like it, if you were convinced that it was a good idea, and the organizer of these meetings, he has to be very careful because all the professors of the university, he said to the group, please, are so nice and put in the best notes, even if you are not convinced, so that we can go on with this holistic approach with 2, 3 teachers each year. And so it really works. Now this year it will have 5 lectures, next year it will be 6 lectures, and so on. So we put in our feet in this theme. And our normal dentistry training courses in Munich, there's a special house for trainings on weekends, and so they had invited me in December last year. First time that they invited a quite alternative method to be done and to be taught in their house, to be taught in their house. And so I think you will be connected more and more during the next years with groups in Europe or in other countries. Australia, they have begun, and so it will be a little new foundation of dentistry all over the world, thinking in new ideas. But now the oral acupuncture, or however we will call it, the field of special points within the oral cavity. My way was that I had been a dentist in 10 years before I changed to ENT. I first had both studies because I had the idea to become a dental surgeon. Because as a child, I told you, I had been operated when I was about 30, 40 years old because I had too much front teeth. I had 2 more than normal, and I had 2 more premolars here. And I was so much emphasized by this operation, I thought it was a mirror, and the dental surgeon did it, that I said, I will be a dentist. And so I became a dentist, and for having the training as a dental surgeon in Germany, we have to do both studies, medical and dentistry. Maybe it's the same here? No. Yeah. And so where I had done my medical studies too, and later on I came to the ENT clinic only for 3 months to have a look at it, and it took 4 or 5 years. I stayed there for a longer time, and so it was my fate to become an ENT doctor. But I used to do injections in special places in the oral cavity already as a dentist, according to the teachings of Dr. Hunig of Germany. Maybe that you have heard his name. He began with his ideas about 50, 55 years ago. He had treated some people, and for example, he gave an injection in his scar. And the patient who got this injection said, what have you done? I can move my knee, I have no more pain in my back. And so he realized that scars, for example, can be a focus, can be something that disturbs some of our regulation circuits, our regulating patterns, and by injecting the scar, something changes. And same to give injections in the segments. segments according to head. And he did some more. He had the deeper injections with longer needles to go to the ganglions of the nerves. For example, in our feet, he gives injections to the infraorbitals, to the supraorbitals, to the mandibular, to the ganglion pterygopalatine. From outside and from inside you can do. So he had a very good work done and had a lot of pupils, but our medical universities, they don't accept this method. They do. Just a fortnight ago, I had a young doctor from the university. He was a private assistant of a very famous professor. He told me, with his private patients, this professor treated by this method, but in his teaching in the university, he never talks about it. And he was asked by his assistant if he wouldn't talk about it. We don't talk about it, but we do. So, we do the same. We don't talk about it, we do. And these injections are very simple to be done. We will talk about later on a little more that you also can have some injections wherever it is, as how it is in the States here. Are you allowed as dentists to do medical work all over the body, or are you limited to the special field? In Germany, it's so that we call it approbation, where if you have examined as a dentist, you are allowed to treat. Not only to treat, in specialty you are allowed to treat patients. And you can prescribe a remedy, whatever it is, for the liver or whatever it is. Nobody can forbid you to do it. Maybe it's the same here? No. Or you are limited?
Yeah, but in acupuncture, if you're certified in acupuncture in New York State, you can use distal points from the foot to the hand.
Wonderful.
Anything.
Yeah. And I think you are allowed to do as dentist.
If you're certified in acupuncture, yeah.
You need a certificate of acupuncture.
In New York State.
New York.
New York. Oh, it's in different states here.
Every state is different.
Every state is different. So you try to get a certificate so everything is okay, so you can do it. And my experience was when I had these injections, according to Dr. Hunike. I like to do it not here in the face, but more inside the mouth, the techniques, infraorbital or ganglion pterygopalatine. So I had to palpate inside to get the direction for the needle. And so I realized more and more, especially when I treated sinusitis patients, that they were very sensitive when I only touched some areas with my finger. And there were some patients that were so full of anxiety and so sensitive that I only gave a little bubble instead of doing the normal injection that I had been taught by Dr. Hunike. So at first I believed I did some wrong, because it was not what he had taught me. I have a long needle and go long up to the ganglion. But I have learned more and more that this little bubble, very superficial, that it helped too. And so I realized why to do deep injections with long needles if you can have the same success in many cases, not in all cases, but in many cases you can have it by a very superficial bubble. And so I palpated more and more within the oral cavity and realized that we have special places in the lips, in the cheeks, and especially in the retromolar space that very often are sensitive to pressure and palpating, but it's on the one hand depending on the sensitivity of the respective patient. One is more sensitive, the other less, but you will, if you palpate very often, you will soon find the differences. Right side more sensitive or left side, upper jaw more sensitive, lower, or the area of the premolars, not the area of the molars, or the area of the incisors. You can differentiate it more and more if you do it. I've done it now in 15 years. All my patients, I have a little palpation, it takes half a minute. It's so quickly done. And you have some feeling of what it is with the patient in this area. And what more it is we talk about. So I have learned if it's sensitive in a high degree, there is some trouble. This trouble in in the terms of acupuncture, has to be called a functional trouble. And it's very important that we learn this word functional disorder. For more and more, we realize that each problem in our body begins as a functional trouble. And the functional trouble in this state is a disbalance in most cases between the psychological factors and the somatic factors. So the body gives us a signal, signalizes to special spots in the mucous membrane of the skin that something is not in harmony, that something is out of balance, that the energy balance, or whatever we call it, is not justified. So that it is like a red lamp, which will show us, help me, do something. And if you feel these points, you can realize the patient really needs some treatment. And so, the next question is, why didn't we realize that such points are situated in the oral cavity? For we all, as dentists, do so many injections there. When we have our tooth extractions or our operations, or when we do injections here, injections there. So the explanation is that these points normally are situated a little more outside to the lips and to the cheeks, and not at these places where we have directed our injections to the root apices. Not in this vestibular fold, but a little more outside. I will show you the pictures, so that may be that we have not realized it before. And the next is, in acupuncture, we can find these points by palpating. Sometimes. Many points are not sensitive. So we can find the points by a bioelectrical measurement. In acupuncture, we have realized that the point is the first reality, and the most important reality that is. For we can measure it by a special detector. This detector is measuring the resistance of the skin, and if the resistance is increased, there's a better energy flow, better bioelectrical skin conductivity, but it's not only the electrical measurement, there is some more. The temperature in these places is changed. We can measure it by very fine apparatus, we call it thermography, and by special bolometer, what's the name? But you know thermography, you can...
Thermography.
Yeah, thermography. So you have to realize that also the temperature at this point is changed. The magnetic field, I have learned by Dr. Diamond, is in a high degree specific in this area, and some more that we can learn when touching the point with the needle, that the tonus on this specific area again is in another state than the surrounding. So that we have several parameters that the point is the reality of acupuncture. That there are specific points, whatever we will call these points, but skin and area is not the same. For it differs at specific areas, at specific points, and these points may be imagined as a network with a specific interconnections, connecting all the body as a cybernetic network, and we can use it. And the classic acupuncture, the traditional acupuncture, explains it as an energy flow. You may have heard about it, the energy flow through the meridians, and many of our experience are in this way that we can agree with it. For if you put in a needle, very often the patient gets the sensation running along the direction as these meridians are running. So that we really have the feeling that these points are in a way points for itself. But in the other way, they are points connected in a chain of points, in a special sequence of points. So not one point is alone, but they are in a line. And these lines are more vertically than horizontal. If you think of the neurophysiology, head, mechanism, so we have the horizontal systematic of the body. The horizontal systematic according to the spine, levels of the spine. In acupuncture, the systematics are more vertical. And this gives us another approach. For I believe that the systematics in our body have to be in two directions. It can't only be horizontal. There has to be a vertical connection too. And the traditional acupuncture talks about the man standing in a polarity. The man who is in a polarity between two different parts of all surroundings you will find on earth. And this polarity is called yin and yang. Whatever we think of polarity, for us it's maybe difficult to accept the words yin and yang, because the Chinese, and in the beginning they like to have Chinese words to talk about polarity. But more and more we realize there are no better words. However we may call it, it is the fact of the polarity living in Earth's conditions. We have the polarity in the electrical current. And if you will ask a physics professor what it is, he can't explain you. He can't explain what you can do with the current. He can explain you all the conditions of the current. But why it is, nobody can explain. And the same is with magnetism. There's a plus and a minus, but if you ask again, they will say, yes, it is. But what it is and why it is, we can't explain. So it's the same with this yin and yang. We have to accept the polarity. And the polarity in medical terms, we are used to handle it, sympathicus and parasympathicus, anabolism and catabolism, inspirium and expirium. This is the same. All the ways of duality, of polarity, the muscles, for example. We know if there is activity in the muscle, or the agonists, the antagonists are in another state. The one are active, the others one are passive in the same moment. And the neurophysiologists, they call it an reciprocal innervation. For these muscles are reciprocally innervated by the nerves. That when the one group is active, the other one can be passive, and vice versa. Therefore, the reciprocal innervation. And what you find in acupuncture, it's the same. We have meridians on the inner side, and meridians on the outer side. And the outer side is the yang side, and the inner side is the yin side. That means the same as reciprocal innervation. When the one is active, the other one has to be passive. But they have to work together. You can't have any movement with only one of these groups. Both groups of muscles have to be together in this movement. And it's the same with our acupuncture system. The yin and the yang, they work together. One helps the other. But the one is the more active one, and the other one is the more passive one. So one is the energy, or whatever we call it, that is developing, that is activating something. And the other one is a stabilizing factor. Think of evolution, of developing anything. It is, if you develop it, only develop, it would go on, but it would be without harmony. If there wouldn't be a stabilizing factor in it. A stabilizing factor, that means that takes it to earth again, that fixes it, that anchors it. And this stabilizing factor is a yin. Bertrand Russell had a very good word about what is yin and yang. I don't know if I get it in English. That the yang is the dynamic factor without balancing, and the yin is a harmony factor without any power of illusion, or how would you call it, without any dynamics. So it's the same again. We have the one factor stabilizing, fixing it, holding it, and gathering something, keeping something, holding it together. And this is a factor old Chinese realized that it is more to the earth. Down to earth, we say. And the other factor, the yang factor, is a factor that is more, as they told it, to heaven. So they said that man, in this energy field, or in this two levels, in this polarity, is standing between Himmel, heaven, and earth. And therefore we have these meridians that run from in this direction, up and down and down and up. Maybe that if we have time in the afternoon we can talk a little about these meridians too, especially about 2 or 3 meridians that are very important for you as a dentist. But I think the most important now that we go on, that you learn the oral acupuncture, the point of the technique, and if you have time left, you give me all your questions and we try to get a little more systematic. But I had to talk to you like a little of this yin and yang and this systematics, for if we have no theoretical base, our brain wouldn't accept. Is it? And so we had the first factor in acupuncture was a point, with all its special kinds to be sure that you use. The second one was that the points are in a line, in a sequence. And the third one is now, how does it work? What is the system in it? And there are several factors we now know, but there are many other factors we don't know. We only can talk about these factors we know. The most important one are these factors of neurophysiology, according to all the findings of Head, McKenzie, Mens, and how pain is directed from outer receptors to the brain. But this is for us our medical teaching we have got at the universities, and so I think we have it in our books and we know it. The next, what we have to mention is that not only the nerves are of such an important in this efferent and efferent directions, but there are other factors, and one of these factors is they had researches, for example, with animals. One animal was stimulated with acupuncture needles and electrical stimulation, and the threshold of pain, is the threshold of pain, had changed. You can control it with a very warm reaction to the skin or whatever you do. It's no problem to control it. And they had another animal that has not been applied with any acupuncture treatment. But this animal was connected with the first one by a little operation that the carotis vessel were connected. The carotis, so that the bloodstream of the one animal could pass over to the other animal. And what had happened? The other animal had changed again in the threshold of pain. So we have to learn it's not only the nerves and the afferent and different fibers of the nerves, there is some more that happens when we do such stimulations. And this is a so-called neurohumoral factor. neurohumoral factors that is a transmitters, serotonin, dopamine, and all these factors, and the newfound factors that are the endorphins. You have heard about the endorphins. These are very important factors, and all the researchers about endorphin, we met Professor Pomeranz from Canada, from Toronto, we had lots of very fine researchers about these endorphins, that these endorphins have an antagonist. And this antagonist is naloxone. If you have any researches with animals or with men, by doing stimulation from skin points or by hurting any skin area, and you know there will be some change and some endorphin activating in the body, if you give naloxone, all is shut up, it's finished. And by this, we can control what it is. So we have a very good factor in our research to control if there is endorphin in it or not. And the endorphins, you know what endorphin is a name for opium-like substances. Opium-like substances within the body, which the body builds up itself, and they are especially in the middle brain, and there are places where they are built up, but also in the spine areas you find a lot of these endorphins. So there are mechanisms within the body, mechanism of reaction for each kind of hurting or stimulation, and so it's not only the nerves, but these neurohumoral factors may be much more important. And the researches are going on about it, and we are very glad that we could learn that there is so much in it, for it gives us an explanation why it's not only the nerve. For all what is a humoral factor would get each place of the body. For our blood circulation, it comes to each place. If we would talk only about nerves, we would say, why is the ear? Yes, okay, we have stimulated the point of the ear, but how can this point of the ear be connected to the stomach? I don't believe it. But if you know that there are neurohumoral factors, you could imagine that there are some more in it. And the professor of Vienna, Pischinger, he already about 30 years ago, he's an anatomy and histology professor, he talked about that we have a system in each body. He called it a Grundsystem, a milieu system. This milieu system is composed of the connective tissue, the cells of the connective tissue, the fibroblasts, of the very ending and beginning of the blood vessels, the capillaries and the ends of the capillaries and the lymph vessels. And the third group are again the nerve, especially the autonomous nerve endings. That these three groups, once more, the connective tissue cells, the fibroblasts and the network of the fibroblasts, that the blood vessels in the finest places, in the capillaries, in the first beginning of it, and the nerve endings, that they are all together in an intercellular liquid. And this intercellular liquid is the same all over the body. It is like a ground substance between all tissues we have. And this system, he taught us, is a system for its own. If I have a problem here in the tooth area, so I get this system, and this system is connected with each other part of the body. It's really like we talk about connective tissue, but it really is a system in its own, and this system, this milieu system, responds as a totality. It can't respond only in the tooth area or in the sinus area. It responds as a totality, and therefore by this system you can help in a wonderful way. For example, injection here in the scar can give a help for a knee condition, but vice versa. If you have a treatment here, or you have a root-filled tooth, and it can for many years give irritation in a special area here, maybe it's the same milieu system. Another place, which may be a very high sensitive place. We know that our body has very different places. So one has weak kidneys, other person has weak joints. We have our places where we are less, we have less resistance in it or less energy in it. And these places are, in this case, first disbalanced. They get their problem first. And so we can cure by the system, but we also have an explanation why so many focuses can hurt and can give problems all over the body. This is a Pischinger professor of Vienna who talked about this milieu system. I think we will have not too much theoretical, only two more theoretical ideas, and we finish with the theoretical. One other idea is a professor of physics who had been researching a lot with photons, biophotons. That is the emanation of specific light frequencies of each cell. And he could explain that each cell sends out signals, biophotons, in special frequencies, and that other cells in long distance can take up the signals like our radio, our television, or whatever it is, our satellites. For in our imagination, we can believe in everything what is connected with each other. If there are nerves between, if there are blood vessels between, if there are lymph vessels, we can imagine that the one place can give trouble or information to the other one, but that it also can be signals by a physical way, like waves. Waves sending out, and they are gathered by another place, taken in, they are modulated. Each cell can modulate these informations by the biophotons and can send it out again. So we have to learn that each cell in a way is like a little radio station. It can send out waves, it can take in waves, and can modulate waves. And if we know about this, we can understand that a meridian not necessarily has to be a special line, a special channel or something. It's enough if there are points, and these points, they have signals, and send signals to each other.
What was the name you gave that?
Pop, Professor Pop.
Yeah,
P-O-P-P.
No, I meant what did you call it?
Biophotons. Biophotons.
Okay.
Biophotons. PH, photons. Biophotons. And the last explanation, only 2-3 more minutes, is that a professor of anatomy and embryology in Göttingen, Germany, he already, in many years, he is not emericated, he doesn't know that, he says that when the embryo is developing, all parts in this embryogenesis are depending on what the skin does, the surface. When the surface begins to fold at its special place, then the bone, for example, inside the arm can begin to grow. But the first signal, the first information, always comes from the surface. So that the first surface, as he has been able to search about it, is the preforming and the informing instrument in the body. It comes information from outside to inside in all our embryogenesis. And maybe, as he and other people now say, that all parts of the body that in a way were connected in the embryo time, in the embryogenesis, by this process of developing, that they are connected in a special way all our lifetime. See how the embryo is lying together. If this is the head, and here is the pelvis and the bladder region, so they are very near to each other, and they give impulses to each other. And later on, when the embryo is grown up, and now it is born, and the man begins to grow. Special parts of different distant parts, they can be connected to each other. Again, because they are very near to each other in the embryogenesis. And all the embryogenesis is depending on what the skin gives for impulses. This is not the theoretical background of acupuncture. Some points, it would never be enough for, it would not explain all our phenomena. But if we have something of theoretical background, we would be more, even if our colleagues who don't believe in it ask us, so we have some words. So they have first to read and they have to look at it, and then we can just begin with it.
Okay, so why don't we take a break now for a few minutes to understand and also to inform. Okay.
I think we finish with the theoretical background. If there are some more questions about it, we can do it in the time after our noon break. That you give me your questions and we talk a little more about this and the acupuncture conditions. But now, I mean, we might go directly in our field that we learn what we can do. For, I say, if we had a meeting and a teaching, it is necessary that you can go on the next day in your practice and begin. If you are not able to begin this technique, then I was a bad teacher. So we have to learn it. And please give me all your questions. Do you have now some slides? I think we can have it out. It is too dark in the room. Maybe you can see?
Yeah.
So we can have it in this. Okay. This is only a little idea about what is with the points in the oral cavity. You see that these points are lying in the upper jaw and the lower jaw and are connected with specific organs like the kidney organs and the liver and whatever it is. We go on, we will learn more of the techniques. The others we can put in the next slide. We have to change each slide. Okay, here's the most important we have to learn. For example, in the area, the region of the incisor teeth, of the canine teeth, better I stand here, okay? In the area of the front teeth, especially in the lower jaw, the points are situated more outside in the lip region. And the distance between the vestibulum fold and the points in this region is about 1 finger breadth. We will train it later. So we can have the next slide. Here once more. You have the vestibular fold, you say, vestibular fold, and the point situated in the lips outside. And if we have our injections as dentists, we do it here, but this is another place. But if we go more to the molar teeth and the wisdom's teeth, the points are nearer to the vestibular fold. And at the area of the wisdom's teeth, they are very near to the teeth. We can have the next, yeah. Okay, once more. The vestibular fold and the points here outside. Now I already will now talk a little about the technique. We will train it later on, but the technique, I use very thin needle, but to have very fine needles in the photography you wouldn't see them. Don't think that I use such needles as I here for demonstration.
30 gauge? What gauge?
30 gauge, 32?
Later on. Excuse me, but we have some here we will demonstrate it. The problem in the oral cavity is to find the points. We talked about palpation. Palpation, that means you can palpate here with your finger this area in a systematic way. And you will find in the lips, in the cheeks, an area that can be very sensitive on pressure. But first of all, you have to do your inspection. That there is not an ulcer, that there is not an aftis or any other wound from the denture or after an operation or whatever it is, that you know the mucous membrane is normal, nothing to be seen. And then you can begin your palpation. And if you palpate, you not only will find places sensitive to pressure, but sometimes you find a little edematous swelling, very little, tiny swellings, or indurations that you feel in the lips and the cheeks, places of induration like a little nodule. Nodule, you say?
Nodule.
Nodule, like a little nodule. And you will have the experience more and more that if you inject at this place, the swelling is gone, the nodule is gone, the induration is gone, so that really there is a change at this place after treatment. And the most important, that the sensitivity of the tissue disappears. And once more, we have to realize that these points are points connected with all the body, as we will talk about later on, and they signalize to us a functional disbalance, imbalance in the body, within the body. Whatever it is, we can talk about later, but they are signalizing functional troubles.
Are these points on specific meridians?
Yes. Yes, we can give them a specific, systematic place within the meridians. So next one, please. Now, we have learned about the points in this area, in the premolar area. Now you see that the points, okay? Good, thanks. That the points go on in the area which we may call the retromolar space. And experience has shown more and more that points in the retromolar space are the most important ones. In former times I treated some points here, some points there, whatever it was sensitive to pressure, or whether such indurations that we found. But more and more I have learned that if I begin treating in this area of the wisdom states and of the retromolar space, that the results are best, and that after treatment in this area, other places of sensitivity in the vestibular area very often disappear. So that this area, this region of the retromolar space and wisdom area is superior in therapy. For medical doctors, it is a little difficult to treat in this area. They are afraid they could do something wrong in this area. As long as they can give a little injection here in the lips, okay, but the retromolar space, they are very careful, and so for you as dentists, it's perfect system. For you it's nothing to do, no problem here to have your work done in this area. It's your place, it's your field, where you are really familiar with. This area, in the upper jaw, wisdom tooth area and the retromolar area, which is situated at this tuberositas maxillaris, is in many of our patients sensitive. In a very high degree sensitive, maybe by 70–80% of our patients. Sometimes more on the right side, sometimes more on the left side, and you can find it by palpation. In the lower jaw, the points are nearly of the same importance, but the tissue here, you know, is not the same as here, and you can't palpate in the same way. you will find in most of your patients that the degree of sensitivity is much higher in the upper jaw than in the lower jaw. But it's not only that the points are more sensitive, but the tissue is of another condition. So we have to take it in our mind that it's not the same condition, but that these points in the lower jaw very often also have to be treated. This picture is not correct because the patient has only 7 teeth. You may have seen, but we may imagine now that this would be the wisdom tooth. This area in the upper jaw, as in the lower jaw, dentists have begun to call it the 9-tooth area. You know it? Maybe you have heard about it before. For the processus alveolaris, in the upper jaw as well as in the lower jaw, is of this size that a 9th tooth could be placed there. And so we call it the 9-tooth area of the lower jaw, of the upper jaw, right to left. It's another name for the retromolar space. And you know which is the most important space in the retromolar region is this one, which we would call the 9-tooth. It's of the same size as if there would be a tooth, a 9th tooth, for example. To give you here some ideas for treatment, for example. One of my first experience was that I had to treat a young man with a sinusitis condition. And I have learned that in this area, all my patients with sinusitis troubles are sensitive. All patients. I never seen a patient without sensitivity or pressure in this area, in the upper jaw. And I gave him my injections here. Please don't think that these points are the only points. You can also have other points a little more to the palate or here and there. These points may only give you the suggestion where it is located. There are other points, for example, here, in the middle, behind the lower wisdom tooth. And this patient I just talked about, he got 2-3 injections here, very superficial bubbles injections. And I used to let my patients sit after treatment for 10 hours, 10 minutes, quarter of an hour, for 10 minutes in the other room, and before they leave, I look at them once more, and I ask him, "It's okay? Some more headache?" So he said to me, "What did you do with me? I can move my shoulders." For I didn't treat his shoulder, I treated his sinusitis. And so he told me that he was a tennis champion. He was one of the most famous in Germany, but I don't play tennis, I didn't know about it. And he had been with many professors, orthopedic professors, in 3 years. And as a tennis champion, he was traveling a lot around the world. He came to London to a professor. He had been in Australia, had been with some doctors there, and he had gone to the Philippine healers. He had to try everywhere. And this little injection, 2-3, they had cured him from all his troubles. And at that time, first time, I realized that we really have fantastic good points in the oral cavity to help patients. It helps in some cases, there are other cases where it doesn't help. But in this case, I really had a good result, and the patient, in former times, before he had the tennis game, he had to be injected with corticoids, and it helped for 2-3 days, and then the pain came back again. But after this injection, he was really cured. But I sent him to Dr. Kramer. One of you met Dr. Kramer a fortnight ago, and Dr. Kramer had treatment with him and cured him with, he had some problems with the amalgam, and he had problem with root-filled tooth, and this was the treatment which helped to overcome the trouble for a longer time. Maybe if he hadn't done the dentist work, it might have been better for some months, but relapse. So it is very necessary that we not only treat the points, but we look what the other trouble is, for example, with the teeth. So I had to learn that this area in the upper jaw, wisdom tooth area and the 9-tooth area is superior for all sinus conditions to treat sinusitis trouble. But sinusitis is also rhinitis, is also flu, influenza. For we really have the big problem treating a flu, for example. The medical doctors know that antibiotics don't help because most of them are virus infections. And other remedies like analgesics or antihistaminics, we more and more realize that they have very bad side effects, especially in a situation where our immune system is in a high degree of sensitivity, in an acute state of influenza, for example. And therefore it's very good to use these points and give patients injections here in this area. And you can use, if you are familiar with it, some homeopathic remedies like echinacea here, echinacea, for example, or others that you know, and you will help your patient in a very gentle way. So, once more, sinusitis troubles, bronchitis troubles. We have learned that each chronic form of sinusitis is in a way a sinobronchitis. And each bronchitis that is chronic in many years is a sinobronchitis too. So we learned that sinusitis and bronchitis in most cases are linked together. There may be more symptoms and more problems in the sinuses or the bronchitis, but they are connected, and you will find inflammations and irritations in the other field too, especially in the ethmoids. You know the ethmoids. In nearly all kinds of bronchitis, the ethmoids are involved. So you can treat also these problems by these points. And these of you who are familiar with the acupuncture system, for example with the large intestine meridian, that runs from the index finger up here, the arm, shoulder, up to the nasolabial fold, here, near the nose. These are the cyst points of the large intestine meridian. They are very important for our treatment in dentistry. The points here as well as this one. These points are also projected within the mouth. You can treat these outer points from inside. And for a dentist, I imagine would it be more comfortable and more normal to have a little bubble inside instead of having a needle sticking outside in the nasolabial fold. And you will feel it with your finger inside. If this area is sensitive, you can have a little bubble here and treat sinusitis or rhinitis or flu by these points. Bronchitis and all these acute conditions. Hay fever, same points. Acute, chronic, allergic, that is a wonderful system of acupuncture. It has the same points for all these conditions. You can use some special points for allergy, for example, on the ear, or other points, but the basic points used to be the same. If it is a chronic condition, acute condition, allergic condition. And the basic points, for example, again and again, are these area points in the upper jaw, wisdom's tooth, and retromolar space.
What do you inject?
Thanks.
Oh, I'm sorry.
Thanks. But please give me the question later. Thanks. And so we have this field, as I told before, a superior indication for shoulder complaints. Maybe that you have a friend or a patient, you know, you can have a try. Yesterday we paid a lady with a very old shoulder, a frozen shoulder. And I will tell you a very important experience. And that answers the question I just have become. For if you have a shoulder complaint, and the patient can't move his shoulder in some directions, it hurts, and this can be done for it hurts very much, or the movement is not possible. So you begin this injection here, and your question, what to inject? You can inject natrium saline solution 09. Natrium saline solution, okay?
Sodium chloride.
Same as what?
Sodium salt. Or sodium chloride.
Saline solution, 49%.
Physiological.
Physiological saline, 0.9. You can give injection with it for it works. You cannot have needle stick in the mouth, so we have to do injection acupuncture. And so we inject either this physiological saline, 0.9, or we can give injections with an anesthetic. But if you use an anesthetic, I will give the answer now, it's good, thanks. If you use an anesthetic, it is very important that you use an anesthetic liquid in a very low percentage. I think that the best is about 0.5. 0.5, xylocaine, procaine, lidocaine, and the next very important is that you don't add a vasoconstrict agent. No vasoconstrictors, as you use it for tooth extraction, for example. No constrictors in it. Try to get, we have it here, 0.5%, 0.5% xylocaine, for example. It is we found. And in Germany, we can get xyloneural in these caputs. For the dentist, you like to use caputs, I'm sure. And maybe that you will have some xylocaine without vasoconstrictors together. It's very important if you use your capute. So, we go on with the shoulder complaint. I injected here in this area about. And the patient said, yes, it's better now. But I asked, please have this movement. No, it hurts. It hurts. So I gave another injection here and there, for example. Now the patient said, okay, now I can lift up, I can lift down. But if I ask, have this movement, oh no, this hurts again. So it was better on this area, but not yet this movement to the back. So I had some more injections, 1, 2, 3, 4, 5 points before, and 1, 2 more, so maybe a little more distally, or here, not to the palate in the side. And now the patient said, okay, now I can move. It's free. And therefore, my suggestion, if you use an anesthetic in a low percentage, as I recommended, you have the advantage you can control by palpation if there is a sensitive area left. If you use a 2% xylocaine or procaine, after the first injection or the second injection, all the area is anesthetic, and you have no chance to control what you have done. If you have a very low percentage of anesthetic fluid, or if you only use this physiological saline, 0.9, your finger will find more points. And this I have learned is sometimes very important for treatment, that you can get all these points necessary to be treated. And the other very good experience is if you use a very low percentage anesthetic, you will have no troubles with your patients, no collapses, and no other problems. Therefore, use a very low 0.5, or you can mix up. I sometimes mix up in my practice the natrium saline with a normal procaine of 1%. I mix up 50-50, so I get 0.5. You can do. So the experience is that we not only palpate before treatment to find the points, the areas, but after palpating, we have the needle therapy, the injection therapy, and after we have done the injection, we have another palpation. This palpation has two purposes. One purpose is to massage the bubble. For we have such superficial injections that the little bubble is going up. And if you have no bubble, you will have done your injection too deeply. It's the best if you get the bubble, so you know you have really done a very superficial injection. I do it in this way. that I have my finger here, my finger on the sensitive area, and I put the needle under my finger. You can see my finger and the needle is under the finger. And I control with my finger where the needle is situated. And when I have the next point, I take out the needle a little bit and go in again with the next point. So that the fingertip and the needle, they are very near to each other during all my treatment. I have now been traveling here and there and had to treat patients without a lamp. But by this technique, unique lamp, I can control by my fingertip where I am and where the needle is sticking. So it's okay, but in your practice you have your very, very fine instruments and you have your lamps, so you can do it in a very good way. And think of it, you can also palpate not only by your finger, you can palpate with a little instrument, with a tube. You have lots of fine instruments for amalgam, for example. In Germany, some dentists demonstrated me that they used to palpate with one of the amalgam stoppers. You say, what's the name?
Amalgam plugger.
Yeah. With them you can palpate with them and have a look here, especially also in this area, for it's more gentle than your big fingertip, maybe. And you can find the points precisely. Okay? So now we have a look to the retromolar space in the lower jaw. I have learned more and more that these points in this area, the area here, you know, is a linea obliqua, what's the
External oblique.
External oblique.
it's the external oblique, yeah, the bone edge of which goes up to the ascending mandible. And at this area you begin to palpate with a little pressure on the bone rim of this oblique exterior. And you will find in many patients some points here or points in this area, but once more, you will not have the same sensation or sensitivity and pressure as in the upper jaw. And you can use in this area a technique which we call the very point technique, that you either with your amalgam instrument palpate here, it will be more sensitive than with your fingertip, or you use the injection needle. And no one can do better than the dentist. So the dentists have a wonderful technique to have their hands sitting and it's a tissue nearby, so that the hand is very calm and gentle in the movement. Dentists have to do it in all the treatments. The doctors, the medical doctors, they take the needle and that's so. They have never learned it another way. But for a dentist it's so normal that the hand has to be fixed at a place, and with this fixed hand you can have this movements, this stabbings or whatever it is. Yeah? So for the dentist it's very nice to learn it. And so you can have this so-called dabbing needle, that the dabbing needle looks if this tissue in this area, especially here, distally of the wisdom tooth and little buccally or lingually of the distal tooth, if this tissue at special places are so, I will say, open, that the needle glides in, that the needle falls in without any resistance. You have really the impression that the needle drops in, that there is no resistance. Normally, if you give me injections here, you go in the vestibular fold with some pressure, with some, with some force in it. But in this area, you will find tissue that is so soft that you can have, as we call it, a non-invasive therapy. And the best therapy in acupuncture, we have learned, is a non-invasive therapy. Not to stick needle here or have injection here, but to ask the tissue, what do you think about this point? And when the tissue is so open for the needle that it nearly drops in, that the needle falls in this very point. So you have the best point for treatment. And another very good experience is that if you touch such a special place, such a very point, most of your patients will give you a reaction very immediately. They say yes, or they say no, or they say here, or that's it, or and, or whatever they say. But it's a very typical verbal reaction, or other patients, they have more mimical reactions. They grimace. Look at their faces. If you touch the point, they will say there is some change in their face, some grimace, and then you have the very point, the best point for treatment. And we have to realize that this yes, or here, what the patient says, or this change in his mimic, it comes so quickly that's not controlled by the brain, but it really comes from the subconscious of the patient. And it means that the patient who says yes or here, he gives a commitment to your treatment. And that's the best we can have for each kind of treatment. Think of it. We do so many therapies. If we are dentists, if we are ENT doctors, whatever we do so many therapy where we are not sure if the patient would agree deep from his inner subconscious. Think of this test that we talked about. The inner voice would say no. But if the patient said here, or yes, or no, you know that is yes. That means yes also in kinesiology. For the patient is ready to take it, to get it. And so these points are really superior if you can get it in this way. Now, the indication for these points in this area, especially all troubles with the spine. That is the lumbar and first the thoracical and the lumbar spine area, and if you come more distally, so it's this area more to the buccal side, and here in the distally part of the wisdom tooth, and maybe a little more to the lingual side towards the tonsils, the arcus palatinus. This area is superior for the cervical spine. Once more, for the cervical spine, distal of the wisdom teeth, a little lingually and a little buccally. This area you can get many of the cervical troubles be cured. Have an examination of your patient before your treatment. You can do it, please, Helen, if you will be so nice. If you only give some movement to the patient, we do it later on. Only some motion that you say if it's up and down, no more. But you will see, thanks. If there are troubles, it's very quickly done, and then you know there is a trouble in the cervical spine, and you can treat it by these points. I have learned by dentists in Germany that they told me, if you have a very long treatment as a dentist, for example, for a bridge, it takes sometimes 2-3 hours. Patient sitting in your chair and suffering by your sliding and boring and stirring over what it is. That the cervical spine, by all the tension, the patient is in a tension. He takes it, he is very, very good in his courage, but it doesn't help that the cervical spine gets lots of impulses, lots of tension by a treatment that takes 2-3 hours. And if you will control the treatment, the movement of the cervical spine, you will find in many of your patients after such treatment that they are blocked. And so you can treat them either after this treatment, or if it's too much, you can have an appointment next day, and if it's the same, you treat them by these points.
Can you treat sciatica in the lower molar vestibular area?
Sciatica is the same area here about the 7th, the 8th tooth, and little more distally, on the buccal side. I have had a lot of patients of sciatica that came in my practice and couldn't go, and I gave injections in this area, and they said, oh, fine, now it's gone. Lumbalgia, sciatica, same area buccally, beginning at this rim of the oblique exterior and up to the 9th tooth area. You test it with your needle if there's something sensitive in this field. Okay?
Will the surgical removal of wisdom teeth alter the position of these points?
Yes, that is a very good question. For we have a lot of operation in this area, isn't it? We take out wisdom teeth, or there are cysts, whatever we have for problems, or there's a dentition difficilis, that's an impacted wisdom tooth. And what to do? We have to realize that this area, according to Voll, you have heard the name of Voll, these doctors who are most engaged in electroacupuncture, that they say that this area is a center of energetic, an energetic center in acupuncture, especially the 9-tooth area in the upper jaw. And that not only somatic troubles, but also many psychological troubles of our patients you will find connected in these points. I have learned that this area here, especially in the upper jaw, is very important not only for the indications I mentioned, sinusitis once more, shoulder complaints, bronchitis, flu, and whatever it is, headache, I didn't say headache, especially tension headache, migraine. You can have a wonderful treatment by these points. But it harmonizes the psychological state in many of your patients. I hope we have time to treat about it later on, why it does.
Are the points bilateral on both sides, or one
yes,
side? Or?
Thanks for the question. For it is a shoulder complaint, for example, or a sinusitis trouble, which is in an acute state. I normally treat from the homolateral side, the same side. But if it's a chronic state, for many months or for many years, maybe a shoulder complaint, a chronic bronchitis, that have been 2, 3, 4 years, it's so chronic that it's better to have treatment on both sides. Also if it's the left shoulder. In chronic states that have been for a long period of time, the psychological balance in any way is no more the normal one. If you have a pain in many years, there's some trouble all over the body. And so it's better to have a symmetrical treatment left and right. But in acute state, acute is sciatica. I only treat here this side where the sciatic pain is to be found. Okay? Other question? So once more, that not only our somatic problems, joint problems, or digestive problems. One of my next experience, same as this patient with the shoulder, the tennis champion, was a lady of about 60 years, a teacher lady, and she got treatment again for sinusitis at this area, and she came to the next appointment and asked me, she had been constipated in 30 years, and she had tried lots of remedies, and she has done nutrition, change in nutrition and many other factors, but she couldn't overcome the problem of a constipation. And after one treatment of these points, the constipation had gone. This was my next experience. The first was the shoulder, the next one was the constipation. So think of it that also the digestive system is very much engaged, involved here in these points. Digestive system, we learn more with the system later on. But only think of the retromolar area for its really superior. Now we have the next slide. Oh, we have to turn it. I didn't do this next. Fine. Here once more, wisdom tooth 6, 7, 8, and this is the tuberositas again, as we can call the 9-tooth area, as if there would be a 9th tooth within here. And this area, very often the points are situated at the outer line of this tuberositas. So you can have points buccally here, here, here. Sometimes you will find points also here. I used to give the injections from the buccally side, from this, and when I do it, I say to the patient, don't open but close the mouth nearly that the teeth are not totally closed. It's a little distance between, and there's no more tension in the muscles. And that is a very gentle method of treatment. And if I will get this point, I used to give the injection from outside, from buccally again, and having the needle directed in this direction, because this area is already anesthetized. It's no more painful. But friends to me, in Munich, for example, an ENT doctor, he says he doesn't like my method. He says, much better to have the mouth open as here and gives injections this. One here, one bubble here, and one bubble here. So you can choose what you do. It's a little more painful for the patient, but it works very well. Next, please. Again, the tuberositas and the points here at the circumference. You understand circumference? Yeah, circumference of the tuberositas. The most important points as we go. No, it doesn't end. Thanks. Now, there are also points, not only in the lower jaw, in the upper jaw, then there are points in that what we can call between. For example, if you put a finger in your mouth between the upper and lower jaw, and you go with this finger laterally, you will touch the mandible in a level where points are to be found, which in the language of acupuncture are connected with the triple heater. And this I also used to take in the system of retromolar points. But it's not quite correct because it's more on the buccal side, it's not retromolar. More on the buccal side and more in direction to the temporomandibular joint. And sometimes you will find points more up at the edge, at the rim of the ascending mandibular, and you can have the injections at these areas, but it's more difficult to get these points. Alan, you remember we had a patient yesterday, we had to give 1, 2, 3, 4 injections till the point was gone. So it's so important again that you have this low percentage of anesthetic that you can control yourself. If the point is gone by anesthetic, you have no chance to cure it really. But as long as you can get it with your finger by palpation, you know and you control yourself that you have not done the perfect work. And you can give a little other bubble. Patient doesn't feel it. Very little only, because it is a little anesthetic, because you have done it in the place nearby. But this very point is not yet touched. And the problems with our temporomandibular joint, TMG problems, there's a field for its own we can discuss later on. But I've seen that some of these problems are projected inside the mouth. You can have the control by palpating outside and by palpating inside. And if it's more painful inside, I begin with an injection inside. You know, outside we have a special technique how to give injections within the joint. Okay, we have learned it, we can do it. But I've seen that with the result is not the best in all cases. In other cases, it can be better to have the injection inside. It's not the joint you get from inside. It's the special points again, acupuncture points. But they can be helpful to solve the TMG problems. It depends on. There are such cases and other cases. Next one, please. Once more, this is it. Oblique that ascends here to the mandible, and here we begin to palpate with our finger. This edge, this rim, this had to be palpated with a little pressure. You feel the bone edge here, and then you can go up. Fine. This is now the retromolar space in the lower jaw. Again, a very bad instrument, only for demonstration. You do it with your fine needle or with your amalgam instrument, whatever you use. This is the buccally area, this is the tongue, this is the wisdom tooth, and again, this area, best by the dabbing needle that you have a try. If your needle hangs here, if your needle falls in a point, or the tissue is so soft that you know or you will have the impression that's the right point, or the patient gives you the signal again. Patient says yes or no or whatever. So again, this was the area of troubles, especially for lumbalgia, sciatica, cervical spine. And now the point on the lingual area, again here, 9 tooth area, and the lingual side. We used to say that you can give your injection to an area which would be the lingual side of the 9th tooth. Imagine that there would be 1 tooth more, and you would give your injections to the apex of the 9th tooth lingually. Okay? But this is a technique no medical doctor will do. This is a technique only for dentists. You understand? But not necessary in all cases to have the injection so deep as the root apex. In other cases, it can be much more successful to have the injections in this area. You see here, or in this area. This is the arcus palatinus, and here's the tonsils, so that you go in the direction in this area here to have a little bubble here or here. So it can be very good, especially for the cervical spine. I think now we finish with the slides because we get tired. It's so dark. We have more light again and open the window a little. So we get tired from so many slides, is it? You have this little paper, and we all will open it. So I need no blackboard and I need no slide. We can do it in this way, that you have it on your knees and we talk about it. Okay? Maybe open the window a little more. It's okay. Little fresh air maybe, good for us. You have this? Yes. Fine. So maybe we can discuss it now. To say that you see the system of teeth in the connection to the body, as well as the oral acupuncture points and the mutual correlations of teeth and the tissue of lips and cheeks in front of the teeth, out of the teeth. They are very similar, most the same interconnections and correlations. And this system of the teeth you have here was elaborated by Dr. Voll and Dr. Kramer. Most of it is Dr. Kramer. He did very, very good work. And how did he do it? Dr. Kramer may have explained to you in your group. They had, it's 20 years ago, patients, when they were drilling the teeth, boring the teeth, they controlled by bioelectrical measurements the different meridians. The stomach meridian, the liver meridian, the spleen meridian, whatever it was. We have a lot of meridians, and so they controlled again and again if there is a change in the bioelectrical reactions of special points. And so they found out that, for example, if they have treatment at the incisor teeth, upper lower jaw, same, that there is some change in the meridians of kidney and bladder. That these points change in their bioelectrical behavior. And this change can be temporary, for 1 hour, for 2 hours, or for 1 day. Normally it's no longer than some hours. And then it is normalized again. And all the other meridians, they did not react. Not the stomach meridian, not the spleen, not the lung. Just the kidney and bladder meridian in special points, they were changed for a period of time. And this was controlled over 20 years by a group of about 400 dentists that are the group of Dr. Voll in Germany, Switzerland and Austria, and they all had the same results. So that we can say there is the truth in it, that there are connections between the incisor teeth and the system of the orogenital tract. For kidney and bladder, meridian means orogenital tract.
Which is the right side and which is the left in this?
As you have it. You see it in the numbers of the teeth. Yes?
That's a European
I
system.
understand that.
Yeah.
Which is
Have
is
you
this the
another-
left? Is this the left side and is this the right
Have you
side?
another system here?
Yeah.
Oh, excuse me, I didn't know that you have another system.
It's all right. If I just knew that which side was the right, the number and system going to the
I-
right.
I-
We get the patient or we sit on the patient's side?
I was told that this was an international nomenclature.
No.
Is it?
It is.
We're gonna use it.
The international nomenclature.
Which number is
And then
18 is number
The
one?
international is that we begin on the right side in the upper jaw. It's one, yes.
International,
Oh, yeah.
American.
Oh, I see, thanks.
We're not international.
Okay, it is. You use the other one. But again, the tooth number 11 is the first on the right side upper jaw.
That's the right,
Right.
central.
It begins on the right side. And left side begins with 21 again. And then it changes to the lower jaw. That's the left side again. It's 31 up to 38. And then the right side 41 to 48. So that we have a circulation system. Right side upper jaw, left side upper jaw, left side lower jaw, right side lower again. I was told it is international, but I see you have another. So we have to, please have your special numbers on it so that you know what it is. Right and left on it so that you have no problems. But on the other hand, we can imagine that there is no problem because you see in the system that we have the same correlations on right side and left side. Also, if you would change now in your mind, it can't have any problem because the right incisor teeth and the left incisor teeth have the same correlation to the bottom. The next one is the canine teeth, in the upper jaw and in the lower jaw. Again, the same correlations, and these correlations are that they are linked to the meridians of liver and gallbladder. Liver and gallbladder connected with canine teeth. John reminds me that we talk later on about heart, because the system of Paul is not perfect with this. If we go on, so we have the premolar teeth in the upper jaw, and the molar teeth in the lower jaw, 6 and 7. These are the same correlations. You see, these two arrows is like a crossing. Now we have a little problem in it that the correlations, the upper premolars and the lower 6th and 7th teeth, they are correlated to the system of large intestine and the lung meridian. You will find. And if we go on in the system, we have the molar teeth, 6 and 7 in the upper jaw, and the premolar teeth in the lower jaw, 4, 5, that are connected to spleen meridian, spleen pancreas, and stomach. Okay? And the wisdom teeth in the upper and the lower jaw, they are connected with heart meridian and small intestine meridian. You find it here, and I think you have to look at this chart very often. Many of our dentists and friends, also, they have it on their table near their patient, and sometimes they look over this. Yeah? But please, if we have such a chart, we have to realize that it is a hint. It is a hint that there is some connection, some correlation between your teeth and inner organs and functions. And that this way of correlation is a double way. It goes from teeth to the organs as well as from the organs to the teeth. That means if there are trouble in inner organs or inner functions, it can as well be directed and manifested in our region, in our feet, for example, in the periodontal tissue. You know some patients who have a periodontal problem, and you find it in a very circumscribed area, just the canine teeth, but not the premolar and not the incisors, just the canine teeth, or just the premolars and not the molars, and maybe just the right side, not the left side, just upper jaw. In these cases, think of it, it can be caused by a functional trouble of these inner organs, signalized and manifested in the periodontal tissue. So we have to realize it is a connection, an interconnection in both directions. But the teeth, we have to accept it, are the more troubling factor than vice versa. For we really have problems with our teeth, we have problems with our periodontal tissue, we know. But if we think of the periodontose and all the periodontal problems in the many of our patients, so we have to realize that this problem is really a problem which is very much connected with the problem of the mucous membranes in our digestive system. In acupuncture, the oral cavity, as it is all what we call oral cavity or oropharynx, lips, teeth, the palate, and whatever it is, the oropharynx and or the cavity, is connected especially with the meridians of pancreas and stomach. So that digestive troubles in a very common way express themselves in the area of the periodontal tissue of the gingiva. And not only the stomach, but as well the large intestine and the small intestine. So if we talk with our patients about nutrition, it's not only that sugar would cause, for example, a caries, and you know about all these problems, but the nutrition problem is as well important for our periodontal problems, because of the interconnections between the mucous membrane in the digestive system and the mucous membrane in the oral cavity. And the most sensitive area in the oral cavity, it is the periodontal tissue. Is it? Yes. So, think of it that these correlations can be put in a chart, but a chart in a way makes us narrow again in our mind. We begin to be narrow-minded. We think incisor is just the beginning, just the no more. But acupuncture is a system of intercorrelations, of interconnections, of functional or regular circuits. You know, you call it regular circuits in the regulation technique, in the cybernetic techniques. We say a regulating circuit. And the circuits, such circuits, used to interconnect each other. We say vermaschen, I don't know the word in English, that one of these they mesh each other. All circuits mesh each other. And think of it, that's the same here with these circuits. For each group, it is a system of 5 groups. The group of the incisors, the group of the canines, the group of the premolar, the molar, and the wisdom teeth. 5 groups. But these groups mesh. We have to realize it. I had some weeks ago treatment with a colleague. Normally these problems are if we treat colleagues. And he got an injection because he was very sensitive at the area of the canine teeth. And he told me he had a little liver problem and so on. Oh good, we will give you here a treatment at the area of the canine teeth in the lower jaw, right side it was. And next thing I got a telephone call and he said, oh, what did you do? Next tooth, the second tooth. Think that all these are interconnected, that they are meshed. that we are not too single-minded in it. And the others, we talked about yesterday with Dr. Diamond about it, the experience, for example, in kinesiology. And in Munich we had a very good doctor who was very perfect in dowsing and all these methods, but he didn't do the full method. And he said all his heart patients, they were found with troubles in their canine teeth, heart attacks. And he had a good statistic of it. And I looked at his statistic, and he convinced me that heart attacks very often are connected with problems with the canine teeth. And in this chart you find nothing about it. You would, in this chart, find it in the wisdom tooth area. So I was very much disturbed, for I could not say I believed in foil, and now comes another one, he says another meaning, and what to do and what to think about it. So we have to realize that this chart is a very somatic chart. You understand what I mean with somatic? Dr. Foll, he looks by his measurement to functional conditions which are the primary cause are somatical. Functional but somatical. By kinesiology, or by the other factors, we find much more in the psychological factors too. And these psychological factors are as well important as the somatical. We have to realize it. We are men who have one side and another side. So one side is somatical, our other side is the psychological side. We are 50-50, even more. And so canine teeth and liver gallbladder in deeper acupuncture understanding means not only the organs of liver and gallbladder, but means that what is connected in the system. The system of liver and gallbladder in the traditional acupuncture includes the function of the muscles all over the body. The function of muscles. And if muscles are in tension, it's very much connected with liver gallbladder, meridians. And if you have heart problems, so in most patients, the problem is that the heart muscle is in tension. And so, now by this explanation, I can agree that as well the canine tooth can be very much linked in heart problems, because the heart as an organ is a muscle. And the cause of the muscle stress is tension. Think of the patient biting so hard and bruxism problems. It stresses very much the canine teeth area and all our emotions. But if you have more time to talk about it, do it in the afternoon. I will only help you to overcome a too narrow view of this chart. We need such charts to learn that there are correlations. But on the other hand, we have to learn that again, he is saying with the university medical science, it is a somatical side which has not yet included in the normal or right way the psychological side. And this chart in a way is more somatical, and the psychological factors we have to include here too. Some questions? Fine. So what about each of these groups? We have to state 5 groups without the retromolar space. If we include the retromolar space, so we would find that in this space is also projected the triple heater, and triple heater is again combined with the meridian of circulation sex, so that all the acupuncture system is projected within the mouth. But circulation sac and triple heater not in a vestibular area. So that the vestibular area has 5 groups, 5 organ groups. And you know that in traditional acupuncture teaching, they talked about 5 elements. And these 5 elements were precisely the same what we find here in these 5 projection groups in the oral cavity, in the vestibule area. For one of the 5 elements, was the element of kidney combined with bladder. Another element was the element of liver combined with gallbladder. Another element was the element of lung combined with large intestine. Another element was spleen combined with stomach. And another element was heart meridian combined with small intestine. So really that these connections of the teeth and the tissue in the oral cavity gives us a new approach to the traditional science of acupuncture that is about 2,000 years old, 1,000 years old, 3,000 years old. I came to China 2 times, last time in August last year, and Chinese doctors now have the tendency to be so scientific as possible. And if you ask them about 5 elements, oh, that's no teaching you're going to talk about. You see, they had all these ideas when they began. They were very intuitive, and they were very philosophical in the beginning of their idea. But now more and more, they go the Western way. And now they begin to research in a wonderful way. In this symposium we had taken, there was a book of all these papers, all these lectures. It was 641, and most of them were scientifically very well done works, researches with animals and whatever. They have institutes. In Peking, for example, a research institute with 500 academic doctors. Most of them medical doctors, physicists, chemists, and all technologists, 500 in one institute. We have nothing in our Western world. We have not 2 in Germany who would research about acupuncture and be paid by the administration. But in China they really have. The only problem is in China that we are a little skeptical about that what they publish, because they have to give good results when they have done the work for many years, because it is a socialistic land, you know. They are paid by the government, and they are very ambitious to have good results, that they will come up and get a better position. We can have our economy by doing a good work with our patients, but the only chance in Eastern countries is to be very good to the upper